the fall 2023 semester, and we have my name is Lee Taggart, and I am the APE Practicum Advisor here at the University of Montana School of Public Health. And today we have 5 presenters. Each presenter is going to take about 10 minutes, and we're going to have Q&A at the end. So if you have a burning question, you can always put it in the chat. I'll be monitoring that. And please hold your questions for the end. I want to introduce our first presenter, and this is Molly Attwater. And Molly did her APE with the Missoula Public Health. Her site mentor is Peggy Schmidt, who's the Senior Community Health Specialist there. And the name of Molly's presentation is Let's Move Missoula. So Molly, take it away.
All right. Hi, everyone. Thank you for having me. My name is Molly Attwater. I had the pleasure of doing my applied practicum experience with the 5210 Let's Move Missoula program at the Missoula Public Health Department. My site mentor for this project was Peggy Schmidt, who's on today. Hi, Peggy. She's the Let's Move Missoula coordinator and senior community health specialist at the Missoula Public Health Department. So 5210, just to give you a little background, stands for eat 5 fruits and vegetables a day, limit screen time to 2 hours per day, engage in physical activity 1 hour a day, and then consume 0 sugar sweetened beverages. Let's Move Missoula is rooted in research that empowers us to understand the issues of physical activity and nutrition, and more specifically, the health disparities and barriers to health within our community. Through national research and local data, 5210 is able to devise strategies to improve the health of all kids and residents. The research supporting this program is rooted in environmental health, childhood obesity, physical activity, and screen time. So 5210 Let's Move Missoula is a community initiative mobilizing projects and partnerships that build healthy kids and residents of all ages, no matter where they live, work, play, or learn. Projects focus on creating environments that with access to physical activity and nutrition and support for social cohesion. 5210 is a daily recipe for health. One of the newer programs Let's Move Missoula operates is called Midday Move, which is an active recess program. Started last year in 2022, and Peggy works with community partners such as Parks and Rec and the YMCA to operate Midday Move at 3 of the public elementary schools here in Missoula, called Russell, Hawthorne, and Lowell. Each of these schools are qualifying Title I schools in the Missoula County Public School District, meaning that they receive free and reduced breakfast and lunch. And Peggy partners with these community organizations to operate the Let's Move Missoula mission through the Midday Move program. So Midday Move happens on Mondays, Wednesdays, and Fridays during the school students' recess time, so usually between the hours of 11 and 1. And volunteers with the Midday Move program join the students during their recess. But really the main objective for the volunteers is to keep the students moving and playing during their 20-minute recess breaks. Volunteers conduct quantifiable research by counting how many students are engaging in physical activity and moving their bodies. Last year, the Midday Move program reported an increase in physical activity, as well as 16% fewer office disciplinary referrals at the schools where the Midday Move program was happening. The kids also have mentioned that if they don't have anyone to play with, the volunteers from Midday Move are there to play with. And one of the really great things about this program is that there's already pre-existing playground supervision, which is the teachers. So really the volunteers can just focus on playing and participating in activities that bring them joy and including the children on the playground. The program increases students' physical and social emotional well-being by providing more inclusive and varied physical activity on the playground with additional positive adult role models, which is always a great thing. So when Peggy and I first met, sat down to talk about how my applied practicum experience could support and bolster her program, she had a lot of ideas. And ultimately what we did is agreed upon these 4 products that would help Peggy as well as her partners streamline the administrative work of the Midday Move program, as well as make the Let's Move Missoula organization and reporting more efficient. So these products were, we wanted to edit and refresh the Let's Move Missoula website to be adopted with the rebranding of Missoula Public Health. So the Missoula City County Public Health is rebranding to Missoula Public Health, and they're rolling out in the coming months new website and all the branding efforts that are associated with that. Also, we wanted to create a master volunteer contact list for access for Peggy and as well as her partners. Create a live participant count spreadsheet to tally all the participants Mondays, Wednesdays, and Fridays when the program was happening at the 3 schools. And lastly, we wanted to create an updated volunteer agreement form that could be signed electronically after volunteers went through their background check. Okay, so here is a screenshot of just the top of a very long spreadsheet that I created. This is the participant count sheet. It's a live document that is shared amongst Peggy and her partners. And it is part of the role of the volunteer to report back how many students participated that day in Midday Move. So this is a live spreadsheet. So the sum of each day's participants is tallied at the end of the year for a grand total. Notice the days here are just Mondays, Wednesdays, and Fridays, and which is when the program will be taking place. And then tabulated at the bottom of the spreadsheet is each school. So this spreadsheet really offers just an easy to use live document that all program partners have access to and can be updated regularly, organized by the school. This is another spreadsheet that I created. This is the volunteer contact sheet, also for Peggy and her partners. And the document really allows Peggy and her partners to maintain an up-to-date spreadsheet with all the volunteer information, including whether they've signed their volunteer agreement, again, which can be done once they've passed their background check, whether they've received their $10 gift card incentive for volunteering, as well as their availability to volunteer. Again, this document is organized by school as well, tabulated at the bottom. And the main objective of this document was to eliminate redundancies and have one place to hold all of the volunteer contact information. I've just blocked out the top of the document here to protect volunteer privacies, as this is already in use. So I mentioned before that the Missoula Public Health is going through a rebranding, and some websites for various public health programs are being terminated in the process if they're deemed out of date. So Peggy and I really worked closely together to update her website, getting rid of any out-of-date information, while also focusing on making the website a little bit more user-friendly for the Let's Move Missoula target audience, which we identified was volunteers, teachers, as well as parents. We also updated the frequently asked questions of the Midday Move program under the volunteer tab and reorganized the website tabs at the top of the site to, again, just eliminate any redundancies and make sure the user experience felt a little bit more fluid and concise. This is an example of the volunteer agreement that we created. This one is for Russell Elementary School. And again, this can be signed once the volunteers have gone through their background check. So the competencies I've achieved through this program, this project with Peggy, with the website design, which we worked on fairly extensively, was to interpret results of data analysis for public health research, policy, and practice. we wanted to make sure that we are communicating effectively with the appropriate audience that we identified for the website, or at least our target audience. And then also demonstrate basic understanding and respect for the multiplicity of values, beliefs, traditions, experiences, and feelings of satisfaction or distress stemming from social determinants in rural or frontier settings. I also had the pleasure of presenting my my project and my work with the Let's Move Missoula Steering Committee and the Health Promotion Department staff meeting. And this is kind of where I was able to perform effectively on interpersonal teams, gather, integrate, and analyze descriptive health data from rural or frontier settings. And then with the volunteer documents, again, gather, integrate, and analyze descriptive health data. So through my work with Peggy this year, as well as my research, my kind of the other part is my practicum was my integrated learning experience, where I was able to write a paper, a literature review on play as a health practice in elementary schools. I really have become very passionate about programs like 5210 Let's Move Missoula, and I wanted to extend my gratitude to Peggy, the Missoula Public Health Promotion Department, and the Let's Move Missoula Steering Committee for allowing me to work with them on this important program and project. I had many opportunities this fall to problem solve while working on this project, and shared some really meaningful conversations about play and the positive impact it has on children and adults alike. Really proud of the work I was able to contribute to the Missoula Public Health Department, and look forward to watching the Let's Move Missoula program continue to grow in the Missoula community. Thank you.
Great, Molly, thanks so much. Nice job.